Fall prevention, part 2 on our presentation. Plan for change. Methodology is to increase patient awareness and education on risk factors of falls, along with implementing fall prevention programs. Design is a qualitative experimental design. Independent variable is education of fall prevention. Dependent variable is the number of falls. Population is a hospital and patients. Sampling method is a convenience sample. Sample size is a unit of 20 people, and data analysis method is ANOVA. Resources needed. We need IT department to make an algorithm on scoring falls, and also to design a program that staff can use to chart falls and also to chart the fall assessment risk. We need the clinical educator to make a fall prevention pamphlets for patient and staff to use. We also need them to make educational material for personalized risk factors. Implementing changes. We can have group huddle sessions each shift, one on the educating healthcare workers on the change, and then 2 to identify patients who are at greater risk for falls. Have sign up on the preparation of changes and when they will be launched, and to have a staff member be proficient in these changes. They can do rounds to show other co-workers these changes and also show them how to access printable material for the patient use. Outcome for changes is to reduce falls, to increase awareness and education of falls risk to patients, and staff education on preventing and reducing falls.
Clinical setting example. In hospital clinical setting of 20 patients and a new fall prevention education program was implemented. New documentation of fall assessment and patient education. Printable education pamphlet available to patient on their personal risk factors. How to communicate changes to administration. Provide results of evidence-based practice study. Show statistics results for reducing number of falls, patient injury, money saved in patient care, reduced number of hospitalization stay, prevention healthcare setting liability, increased quality of life, patient satisfaction.
How to integrate this change into current practice. Educating patients and family caregivers regarding ways to identify and reduce the risk of fall. Promote case management follow-up to patients discharged from acute and subacute settings, identifying those patients at greatest risk of falls and focusing targeted interventions towards those identified. Monitoring progress and outcomes. Progress. Documentation on patient education. Do they understand? Can they verbalize back to you what you taught them? How many minutes was spent on education? Education needs to be completed each shift. Outcome, clinical setting will see a reduced number or no falls.
Here are our references and our second page. That concludes our fall prevention PowerPoint. I hope you enjoyed it. Thank you for listening.